This is a staggering fact. Women are more likely to die from heart disease than any other disease, even breast cancer. Yet many women don't realize this, and I can imagine why. Leah, this is an awareness point. And for Heart Month, our health specialist Leah Sarich is here with why women must be aware of their risk for heart disease so that you can get the treatment that you need in time.
Because it's just not on the radar for a lot of women and a lot of health practitioners as well. So this is why we need to do some awareness raising, and this is why I do this every year at this time. So 1 in 2 women will die from a cardiovascular event, so a heart attack, something like that. One of the main reasons why is, as we've discussed, women often underestimate or even dismiss the symptoms that they might be having as something else. So they may not even recognize that they could be having a heart attack because their symptoms may not be that crushing chest pain, you know, you see in the movies where people are like, oh, that kind of thing. They may not be having that. Women don't necessarily get that symptom, and Dr. Gillis explains.
The classical symptom of a heart attack is crushing central chest pain. Women may not have that symptom. They may develop indigestion, they may have what they consider as heartburn, and so dismiss the symptom. Or they may have some other vague symptoms of shortness of breath or arm pain and not really think that they could be having a heart attack. And then when they seek medical attention, they may be somewhat vague in how they describe their symptoms because they're not thinking it could be serious.
So when they're not thinking it could be serious, of course, then they're not telling the doctors when they show up at the ER, you know what, this could be a heart attack. So they're just not even thinking about it. And that, of course, leads to a delay in diagnosis and then a delay in treatment. And it's all about time when you're having a heart attack, because the sooner you get that treatment, then the sooner you're restoring blood flow to the heart. Because, of course, the longer that is delayed, then the more damage occurs in the heart. So you want to get that treatment sooner than later. The other thing to really be aware of is if you're postmenopausal. So estrogen does provide a protective benefit when you have it. But as you go into menopause, estrogen decreases, and that, of course, increases your risk for heart disease. So women and men, in fact, after menopause are at the same risk for heart disease. So we need to know that.
Interesting. And let's talk about risk factors then. What are the big risk factors?
And these are the big risk factors. So again, postmenopausal, that's a good one to start right there. But what you want to do is at your annual physical with your doctor, you want to establish your cardiovascular risk. So there are a few risk factors you can't change. So you can't change your age, and you can't change your medical history, your family history. So those things you can't change. But there are many others that you can change. So things to be aware of. Blood pressure, make sure it's under control. Cholesterol, make sure it's in check. Stop smoking if you're smoking. Exercising, and not just to lose weight, but also to really maintain that good cardiovascular, that vascular health, those blood vessels. Make sure they're working properly. And then if you have diabetes, make sure it's under control. It's also important to understand if you've had certain complications, even in pregnancy, and this could be many, many years ago now. But if you had certain complications in pregnancies, those can put you at risk for heart disease much later in life.
Wow.
If people develop preeclampsia during pregnancy, so that's elevation of the blood pressure, that is a risk factor for developing cardiovascular disease later on in life. And the same thing with gestational diabetes. That's a potential risk factor that those individuals are at greater risk of developing diabetes in the future. And of course, that's an important risk factor for subsequently developing cardiovascular disease.
The other thing women need to be aware of, too, is that they may actually have a different kind of disease than men. So heart disease can look different in women than it can in men. With men, they often have the big blockages in their arteries, so the big ones, the big cholesterol plaques is what they are. But in women, Dr. Gillis says they may often have small vessel disease, so not the big blockages, but just that the vessels aren't working the way they should, so they're not getting the right amount of blood flow to the heart. So it may look like an entirely different disease. So women really need to know, especially if you're postmenopausal, could these symptoms be a heart attack? Could this be happening? And then suggest that when you are at the ER. Can you say, maybe this is a heart attack? Things to be aware of so that you can certainly get the treatment you need in a timely manner.
And advocate for yourself.
Advocate for yourself, as I always say.
Yes, more info on your blog, breakfasttelevision.ca. That's where we can find that.